Ladies, you're either going to love this conversation or you aren't. Just kidding, kind of. Plastic surgery and body contouring has come a long way. Gone are the days when getting any kind of work done meant you would end up looking like the Catwoman. These days, procedures are performed with new techniques that allow more custom work tailored just for you. The goal being that you are simply a better version of you. With all the possible procedures out there, it can feel overwhelming. And I think that a lot of people still don't feel comfortable talking about it and asking questions to their friends. I would bet there are women you know that have done one thing or another at one point in time, but just keep it to themselves. Do you ever find yourself seeing one of your friends or a woman on the street and thinking, gosh, she looks good. I wonder what she does. Well, today I have a treat for you. I was so honored to have Dr. Dan Hatef on the show. He is one of the top plastic surgeons in the country, and we are happy to have him call Nashville home. He has patients come from all over to see him, and today he is answering all your questions about what we should do to look and feel our best. From boob jobs to Botox, no question was off limits. He is sharing all your options, surgical and non-surgical, and what you should be doing and looking for when you are trying to navigate your own plastic surgery journey. He actually arrived in his scrubs straight from performing a rhinoplasty. He is a very busy man, so I just feel really beyond honored that he took time out of his day to sit down with me for all of you to hear. So without further ado, let's get to it. Here's my conversation with Dr. Dan Hatef. Well, welcome to the podcast.
Thank you so much.
Dr. Dan Hatef. We were just having that conversation. I am so happy to have you here. So I'm going to introduce you just for a quick second for those listening who might not already be following you. You are a board-certified, award-winning, double fellowship-trained aesthetic plastic surgeon, which is a mouthful. You have your own practice here in Nashville, and we don't have to name names, but you are definitely responsible for a lot of famous faces and bodies walking around town. You do not have to confirm nor deny that. I said it, not you.
What I tell people is that when you watch like CMAs or ACMs, anyone who looks bad, that's not my patient.
That's not you.
People who you're like, you kind of can't tell is my patients.
Yeah, because it's like a walking advertisement. How did you get into this field? Did you know you wanted to be a plastic surgeon?
So, I grew up in the DC area. My dad was a doctor, and he was from Iran, and he was super academically oriented. And so I was like told I was going to be a doctor from a very young age.
Oh, wow.
And
it worked.
Oh, yeah, it worked. My mom has like this picture of me from when I was really little. It's my son, the doctor, this little shirt. I'm like 10 months old, and I have like this little toy test.
There was no
stethoscope.
choice.
Yeah.
Wow.
Yeah.
Maybe I should have tried that. Are you doing that with your son?
No. I mean, we make him work hard. I mean,
Yeah.
and he really works hard, and he's a good student. But whatever he wants to do, as long as he's working hard and doing what he's supposed to do, we're happy.
I love that. Okay, so you knew you were going to be a doctor.
Well, yeah, and I thought I would be a surgeon when I was young, but I had a rhinoplasty when I was 16.
Oh.
And I would say that definitely encouraged me to think about plastic surgery. But I had a lot of fun in high school, so I wasn't really very well prepared for college. So kids, if you're in high school and you think like none of this, has any, relativity to what I'm going to do when I get older, it's actually all preparing you for college, and you got to do well in college. And so I did really well in college, but because I wasn't prepared, I had no fun. So then when I got to med school, I was like, all right, party time. Yeah. And so basically I thought, I don't want to be a surgeon. That's too much commitment. But then, you get into med school and you get in the rhythm of things. And second year med school is like, okay, I really started to mature, settle down, and I was like, all right, what do I want to do with my life? And so I pretty quickly realized I wanted to be a plastic surgeon. So I'd say second year med school, like 23 years old, maybe 24. Okay.
Do you just do plastic surgery, or do you have to focus on something?
So basically what you do is in med school, you decide what you want to do. And if you want to be a plastic surgeon, you either become a plastic surgeon right out of med school. We have, 6 to 8 year programs that you go into right out of med school. And then other people, they do general surgery first, or otolaryngology, or even oral maxillofacial surgery. And then they do plastic surgery for like 3 years after that. So there's this movement now to where they're getting rid of those independent spots after plastic surgery. And this is like such plastic surgery nerd talk right now, but it's like an important thing to me that even though I did the integrated route, I did only plastic surgery. I think that those spots are really important because you have really talented guys in general surgery and ENT and OMFS, and they want to do plastic surgery, and they should have that opportunity. And I think that we're not doing a good thing for our specialty by getting rid of those spots later on. So I always have this conversation with my academic colleagues.
Okay. Well, maybe you'll change the world with it. All right. So I don't know if you would call yourself this, or I was even going to ask you, you are known, I know this, for your noses.
Sure.
If someone wants a new nose, they are likely hoping at least to come to you. And like your before and afters, I don't really think I need a nose job, but it makes me want to get one just because I'm like,
you don't need one.
Wow, this is amazing. Do you when did you learn, okay, maybe I like doing one thing more than the other, or people are coming to me for one thing over the other?
Yeah, I mean, I love facelifts. I love breast augmentation. I love complex breast stuff. I even love liposuction. It's like liposuction is the one thing in plastic surgery that most people do not love.
Yeah.
And I even love that. I just love shaping the body and making people look better and feel better. I think noses particularly are something that I'm busy with because I took an interest in it from a very early stage of my career because I'd had one.
Right.
And, I spent 3 years in Dallas and 7 years in Houston. And at Dallas, girls, rhinoplasty is very popular.
Okay.
Girls would get rhinoplasty and breast implants like for graduation from high school.
In Dallas?
Yeah, Dallas is,
Wow.
very, very bougie like that.
Okay.
And so, I really got a lot of exposure to it early.
Mm-hmm.
And then when I was a chief, we'd always have these, competitions, like pissing contests about who did the most of this and who did the most of that. And so the rhinoplasty record for chief, in the chief resident clinic where people, like if you don't have much money and you're trying to get something done, you can get it done for a much more economical price if you go to like the resident clinic. So,
I didn't even know that was like an option.
Oh yeah. So like ladies, if you're listening and you're young and you're struggling and you want plastic surgery, go to Vanderbilt. They have a chief resident clinic there. That's like
Did not know this. Yeah. All right.
Yeah. So the record was like 4 or 5. One of the guys in Dallas who ended up in Beverly Hills, he's a great rhinoplasty surgeon now. Ash Gavami, he did like 5, and everyone's like, "Oh my gosh, he did 5 rhinoplasties to chief." I did 24. Because I was just like a psychopath from day one in residency. I'd collect the names of the people who had nasal fractures when we were on call, and got their information, and I'd call them and get them in when I was a chief. Like at the VA, I'd be like, "Hey man, you need a new nose. Spend the night, spend a few nights in the hospital because you're trying to get noses any way you can." So.
Wow. All right. Yeah. I love that. All right. So
we might edit that part out.
No, that's fine. Okay.
I'm just kidding.
We can. I opened up questions because, and you and I have had this conversation a few times about the just kind of overall stigma when someone hears plastic surgery. I think it got a bad rap years ago, or maybe someone knew someone that got a bad job somewhere and they're like, "Oh, plastic surgery, it's fake, it's plastic, it looks terrible." And so I just think taking away the stigma of it always looks one way, or a facelift always looks like, your eyes are pulled all the way back in your head, or the nose looks too skinny. So I opened up questions on Instagram. If they could ask a plastic surgeon anything, what would it be? And the response was actually overwhelming.
Love it.
And I think if I had put that as a question box on like my public feed, I probably would have gotten next to no questions, because I think people don't want other people to know that they're asking, because there still is, for some people, a bit of that stigma.
Sure.
So we are going to ask you some questions and get ourselves educated. All right. Top 5 plastic surgeries performed in the U.S., according to the internet, are breast augmentation, liposuction, nose reshaping, eyelid surgery, tummy tuck, and a facelift. Agree?
That's like my practice right there.
Okay. And you're done for the day. All right. So breast augmentation, a lot of people wanted to know, and I was curious as well. I feel like we hear a lot recently about fat grafting. So either instead of getting implants, you're getting fat taken from your body, or people are getting their implants taken out and replaced with fat. Is that like, can you tell us what that is?
Very legitimate. I typically don't do fat grafting in primary breast augmentation, meaning if a young girl comes in, just wants larger breasts, we typically just do breast augmentation with silicone breast implants. I use a lot of fat though, and the people that I use fat in are people in whom I do augmentation mastopexy. So augmentation mastopexy is where we do a lift and place an implant. And typically I'm doing that with like a mommy makeover. With a mommy makeover, I'm doing all this liposuction. So we have all this fat.
What is a mommy makeover? I feel like we hear that all the time.
Yeah, mommy makeover is just like the colloquial term for fixing breasts and the abdomen and torso all at the same time.
And liposuction.
Yeah. So typically I'll start a patient on their stomach, do liposuction, shape out their back, and then we'll turn them on their back, and then I'll do the tummy tuck and breasts, and sometimes we even turn them on their sides and inject a little fat into the butt. That's why we call it a mommy makeover, because we're addressing multiple things at once. And it's grueling. It's grueling surgery.
Yeah.
And but it's very rewarding.
How long does that surgery take?
I mean, if they do all of it, like 5 hours, 6 hours.
And sounds like a very large recovery.
It is, yeah, and it's risky, and so I definitely lay the crepe with patients and tell them, like, you could get a blood clot. I probably talk out. I probably
because of how long the surgery is.
Yeah, how long the surgery is, and you're when you're doing a tummy tuck, you're dissecting the entire abdomen, so that causes a lot of inflammation. Liposuction causes a lot of inflammation, a lot of fluid shifts with liposuction, and when you inject fat into the buttock, fat can get into the muscle, go into the veins, and it can go into the lungs. And you hear about these deaths in South Florida. That's what they're from, is from people injecting fat into the butt. Now, the way I do it, totally safe. I take extra steps to make sure that I'm above the muscle, and I tell patients, we're making your contour better over time. These contour irregularities will even out, but at first they look a little lumpy because you're right under the skin. So at least my patient population.
If I get fat injected into my...
You don't have any fat.
No. Okay. If I had fat, which I do, to inject into my butt cheeks, what happens if I lose 10 pounds?
It'll deflate.
It goes just the same way.
Yeah. That's why I tell patients don't gain weight for surgery, because it's just, if you lose that weight.
So you want to kind of make sure you're at the weight is a normal weight for you.
It'd be optimal.
Okay. How does someone know if they need implants or a lift and an implant, or just a lift?
So best thing to do is see a board certified plastic surgeon who does a lot of breast surgery. And, you're either in the category where it's obviously you just need breast implants, or you need implants and a lift. There is like that in-between patient who just needs a lot of volume. And so with those patients, you can avoid doing a lift if you put in a bigger implant than you normally would.
Okay.
That patient just has to understand that you're going to look big. The implant is going to stretch your tissues. So at some point, you probably are going to want to lift, because the implant is going to weigh down and bottom out and go to the side over time. But, now that we're using mesh in the breast, I use an absorbable mesh. There are two different kinds of absorbable mesh that I use, and it's really good for forming a strong scar internally. And so the implant doesn't do that as much over time. Okay. So that gives us the option of going bigger and filling out that envelope, and maybe avoiding a mastopexy, because for my patients, at least that I see, it's not the scar that they want to avoid, because the scars always actually look pretty good. It's the loss in sensation. Right.
Because anytime you make an incision, you're losing sensation.
Especially a lift. You're gonna go from whatever your sensation is to much less.
Yeah.
And with breast augmentation, you'll lose a little bit of sensation, but not like a lift.
If someone has, I don't know, loss of tissue from having babies, but it's like, I just want to get a lift, is that, like, are the results still good with that if you don't do an implant?
If you don't put any volume in, typically you're kind of just moving nipple around. I mean, we can, reshape the breast tissue itself, and I do that, and I will use that mesh again to kind of help with that.
Yeah.
Help put that tissue into place. I've been doing a lot more of that without breast implants, and if the patient has fat that I can use, if they have enough fat to to harvest
somewhere else in their body.
Yeah, and I can inject fat. That's great because I feel like those results rival my breast implant results.
Wow.
Because they last and they look really good. They look natural. They look more natural.
How often do you have to take out regular implants? Like how long would those last?
I take out some implants and I'm not really a breast explant surgeon. There are some people who do a lot of, breast implant illness surgery. I don't really do a lot of that just because to really do the en bloc capsulectomy. So if you think you have breast implant illness, you're probably familiar with the term en bloc capsulectomy. I see a lot of patients who've had that and they're not happy because it's a little bit deforming to the breast, the scar. To get all that capsule out safely, you've got to make a really big incision, and the scar just doesn't look good. The breasts look deflated in kind of a weird way. So I've actually corrected a lot of that. So I try to avoid doing that, and I recommend they go see the surgeons who do it a lot because, that's a huge part of their practice and they're very good at it.
Yeah.
And I'm not one of those people that doesn't believe that breast implant illness is real. Actually, going back to how long I've been interested in plastic surgery, I mean, I had a discussion with this guy, Scott Spear. He was the chairman of plastic surgery at Georgetown when I was like, I'm not even a medical student yet. I spent time at Georgetown with him, and so I asked him if, do people ever have allergies to implants or problems with their implants? Because, that was during the time when they had just eliminated silicone implants because of the scares back then. And he said, I've had a couple of patients that I took their implants out and they felt much better. So, he wasn't.
Are there symptoms of the breast implant illness?
It's a pretty broad and vague constellation of symptoms. People talk about brain fog, fatigue, joint pain, joint issues. We have not isolated any kind of like rheumatic factor or, immunologic interleukin protein or whatever that could be linked to it. There's some data to suggest that maybe it's the weight of the implants on the chest wall. And, I do have patients who they say they love them. They don't want them out, but they're like, yeah, when I lay down, I definitely feel them on my chest wall. So, I mean, if your sleep is disturbed, even to a point where you don't even realize it, you're just not sleeping as well. That could explain some of the things. So, and then you take them out and immediately the chest wall recovers and you're sleeping.
You feel
normally.
lighter.
Yeah. So maybe, I don't know.
Yeah. Can you breastfeed if you have implants?
Typically, breast augmentation will not eliminate your ability to breastfeed. So you may have a decreased ability. You may not be able to at all. It's something we can't guarantee, but it's not going to totally take it away for most women.
So if I am coming to you and getting implants and a lift, what recovery time am I looking like?
So implants and a lift is different than just implants. Just implants, I mean, I have girls that are like stylists and they're cutting hair the next day, which I hate when they do that. But they're all so hardworking. They they're in there. They're up, do it. But the lift obviously adds recovery to it, and it's not that painful. The pain is mostly from putting the implant in. But I definitely like patients to avoid too much activity for a couple weeks because I don't want those scars to stretch out and want them to heal nicely.
All right. Your favorite topic, rhinoplasty. Okay. Commonly referred to as a nose job, is the most popular facial plastic surgery procedure, averaging around 225,000 surgeries a year. Does that sound a lot?
Well, one of those 225,000 what made me late today, so.
There you go. Okay, 224,000. Okay, so as someone who had rhinoplasty, why do you think it's the most popular?
I think that really the nose is such an important part of the way we look, and if you look at these like ocular scans, they have computers that you can look at a piece of paper and there's a computer in the background. It can look at where your eyes look. And it's just shown that you look first at someone's eyes and then their nose. And so if someone has a quote unquote bad nose, you stop looking at their eyes and you start looking at their nose. And so I think that's a huge indicator of what we subjectively refer to as beauty.
Okay. Is just a nose job, or is there different ways to do it?
Oh, there are plenty of different ways to do it, and it's constantly evolving. I mean, it's my practice has evolved in the last 2 years. I used to do just typical what we call open rhinoplasty. So it used to be the two general ways to do it are open and closed. And open is where you make an incision in the middle of the columella, which is this portion that separates your nostrils.
Yeah.
And then there's closed rhinoplasty, which is where you just make incisions inside the nose. And so training in Dallas, we only did open rhinoplasty. And that's one reason I went to Houston for finishing my training, is because they did a lot of closed rhinoplasty. A couple of guys did a lot of closed rhinoplasty there. And I just, just from being in Dallas and spending time, I really got used to the open approach. And so that's what I used for a long time. And then some guys were showing us that something called preservation rhinoplasty might lead to better outcomes. And so I've sort of switched over the last 2 years to doing more closed rhinoplasty, like not all the time, but sometimes. And then I've only done preservation rhinoplasty for like the last 2 years, even in my revision cases. So, a lot of us around the world are pushing that preservation rhinoplasty envelope. And for everybody listening, what preservation rhinoplasty is when you open the nose, when you do a rhinoplasty, and you take the nose apart.
When you say open the nose,
Right.
are you still at the bottom?
Yeah,
Okay. So I don't know
this
why I'm
cut.
envisioning it like here.
Yeah.
No, it's down here.
Yeah,
Okay.
down there. And then you deglove the nose to expose the cartilage and the bone.
Deglove the nose. Gosh. Okay. This sounds amazing. You say it with like such enthusiasm. All right. So we've opened the nose. We
Yeah.
have degloved it.
Yes.
Yes. Okay. Sorry. Carry on.
So when you take it apart, you got to put it back together.
Right.
So sometimes when you put it back together, it's just not as accurate and it doesn't heal as well. So the more that you can preserve, if you can, obviously you're doing a surgery to make a change, but there's some things in the nose that you want to maintain. And so one of those things is these lines. They're called the dorsal aesthetic lines.
Like the bridge of your nose.
Yeah. So when you do a preservation rhinoplasty, instead of me taking the hump down here,
Yeah.
I'm actually taking it out inside the nose. So I'm taking out tissue from inside the nose and breaking these bones and pushing the nose down into the face to get rid of the hump.
That's like,
Yes, I don't know if preservation is a great title.
it doesn't
'cause I
really
don't know-
sound like
yeah, I
that's
don't know
like
how much we're
nose
preserving.
breaking, shifting around, degloving. Wow. All right. Okay. So unlike an implant though, is that lasting you forever or might it shift and you need it?
It will change.
redone?
It will change over time. I mean, even my nose, I used to have a nice straight dorsum. It was great, but now over time, my tip has come down. And it's just gravity, aging.
Okay. So that's not because the surgery's quote unquote coming undone. It's just
No.
aging and okay.
Yeah, it's just
Right.
aging, and sometimes, and I've seen this in a couple of my patients. I mean, you can have this great result on the table, and whether it's swelling or maybe a little low grade infection, your nose can change over time. And so that's why I do a lot of liquid rhinoplasty. So that's
Yeah.
where we use filler.
I did that.
Yeah.
Yep.
Yeah. But I tell patients, I'm like, if you think you're going to have a real rhinoplasty, think twice about doing this because, you can introduce bacteria and you can damage tissue planes.
Yeah.
And so, for someone who probably is not going to have rhinoplasty, it's great. But
So liquid nose job is just when you take filler and
Mhm.
inject it into the bridge kind of area of the
Yeah.
nose to make it look more straight.
yeah, and I do it in the tip a little bit too.
Yeah, that's right. Yeah.
Yeah.
And how long does that last?
Depending on the filler, it should last about a year. There's some fillers that last longer. And so I'm starting to, patients like yourself who
Yeah.
have done it and like it, I'm starting to transition those patients into the longer lasting filler.
All right. Recovery time on a nose job.
So depends on what you mean by recovery time, because
When they can be seen in public without all the bruising and the white
I'd
bandages.
say 10 days.
10.
14
That's not
days,
that
yeah.
bad.
But you still be swollen. I mean,
Yeah.
I have some patients that their swelling's going in 3 months. They look amazing.
Okay.
Then I have other patients that 12, 18 months, they're still swollen and they're still like, I love my nose when I wake up in the morning, or I love my nose after I, go to this, go to cryotherapy or whatever. But, it's swollen most of the time. So it takes a lot of time.
Okay. If someone is, say, going for a consult to a plastic surgeon, should they find a photo of a nose that they think they like, or is it better to just let the surgeon kind of look at them and be free to decide?
I personally like when they bring in pictures.
Oh, you do?
Yeah,
Okay.
because there are things that I can do to make your nose look a different way. So some people want their nose to look more stylized. And what I mean by that is they want their dorsum really, really sculpted, and then they want their tip above the dorsal line. So they want almost like
a ski jump nose.
Yeah, like a ski jump a little bit.
Okay.
And then other patients hate that. So when they bring in pictures, it helps me get an idea of what their aesthetic is like. But what's interesting is that a lot of patients will bring in pictures, say, well, I don't want to look done. I don't want that ski jump nose. And they show me pictures, and it's like,
you're like, that's a ski jump nose.
Like, yes, it looks very done. And they'll show me pictures of girls who I know have had rhinoplasties, and I know that if they had that person's nose, they would think it was overdone. So it's interesting.
So what happens if you're like, I can't do this? A, because it won't look good. B, you're represented. I don't want you telling people I did your nose. I mean, do you have to tell people I can't do that? It won't look good?
Only in this revision cases. And it's not that I can't do it. I just tell them, like, look, all right, you've had patient that I did this morning, this is not the surgical rhinoplasty. This was a patient who had like 4 rhinoplasties before. And so just completely scarred in. And so I told the patient, if I operate on you, you could look like Michael Jackson. Like, you could completely lose your nose. So what we're doing is we're just injecting fat and PRP and try to get their tissues healthier. And we've actually made the contour better as well. Now, whether or not the patient will be happy with that. That's
a surgery?
No, just in the office, harvesting fat and injecting it in the nose.
See, I didn't know you could put fat in your nose.
Yeah. Well, it's not the best thing in the nose for cosmetic purposes, but for bringing healthy cells for a patient who's had 4 previous rhinoplasties and their blood supply's not great, it's good.
Okay.
So if we end up doing a rhinoplasty in that patient, their tissues will be healthier, they'll get a better result. But those are the patients when they've had 1 or 2 before and they come in, I have a talk with them. I say, look, your nose is never going to not look done because of X, Y, and Z that you had done before. I can make it look better, but you always look like you had a rhinoplasty.
What is like the primary complaint if someone gets a quote unquote bad nose job?
So in my hands, my patients mostly complain of just swelling for a long time. And sometimes before I was doing preservation rhinoplasty, what I'd say my most common complaint was those irregularities. And I've pretty much eliminated them by doing the preservation rhinoplasty. And so I've done some takebacks and corrected that, when they have little irregularities. And I'm aggressive about correcting my own work because, we're not angels, we're men and women. And so we don't always get it right, and the patients don't always heal just right. So I'm open to revising stuff because I think that it's necessary sometimes. And noses that I get from other doctors, most of the time it's that their tip has been really overdone. And so, the doctor completely divided these cartilages and took a lot out. So even though they had their dorsum taken down and they thought they were going to have a straight dorsum or even the ski slope, it's actually the opposite. It's like a hook where the tip is below the dorsum, and they always hate that. And then like the hanging columella where this comes down a lot. And then alar notching, which is where the nostrils look kind of, you can see too much of the nostril. It doesn't look normal, looks scarred. So those are like the 3 things that I see kind of a lot. But the good thing is they're actually easy to fix.
Fixable. Okay. Yep. Liposuction. I might have thrown some of my own questions in. Just kidding. All right. Who is a candidate for liposuction?
Really, anybody is a candidate for liposuction. I mean,
you don't have to have a certain amount. You don't have like a cellulite scale that you're like, you don't have enough.
Well, what I tell patients that are not candidates for liposuction, it's not that they're not candidates for liposuction. It's that, like, if you have excess skin on your abdomen, if I do liposuction, it's going to make your contour better in a way. Like when you have clothes on, it's not going to be as full. But I'm deflating your skin. It's like a balloon. So if I take out all that volume, it's just going to be this saggy, wrinkled mess. So sometimes patients, we can do liposuction, but we need to do a tummy tuck as well. And then there are certain body parts that just don't respond well to liposuction, like thighs and arms.
Thighs, okay.
Yeah.
Like back of the thighs or front of the thighs?
All. Yeah.
Which is where I feel like you see most cellulite. Like even on women who maybe don't have a lot of fat,
Yeah.
You're seeing cellulite.
Yeah.
So they're like, okay, well, maybe I need to get liposuction.
No, cellulite's.
That's not what.
Yeah, cellulite's not a good treatment for. I mean, liposuction not a good treatment for cellulite.
Okay, see, I feel like I have been wrong all these years. I thought that that's what you did for cellulite was liposuction. Liposuction is purely for fat.
Fat, yeah, deep fat.
So even if you took out the fat, the cellulite would still be there.
Oh, probably worse.
What?
Yes. Yes.
It's gonna get worse.
Yes. Your contour will be worse. If you're in good shape and you just have cellulite and someone does liposuction, those are deformities that I'm injecting sculpture or cadaver fat.
Yeah.
It's a cadaver fat that's had the cells taken out, obviously. Those are the patients who have these contour irregularities that I'm, working on.
Do you know what I had done years ago before I knew you? You're probably about to really cringe. I regret it. I don't even know the actual name. It's embarrassing. Aqua lipo.
Oh, aqua lipo. Nice.
This wasn't nice. It was terrible. And okay, so I think I have two dents.
Yep.
They look like dents
Yep.
is the best way I can describe them.
Yeah.
Short of being like a hole, two dents in the back of my thighs. And I remember going back for my follow-up and I said, I don't notice any difference.
Yeah.
And then he was like, no, I see a difference. I'm like, buddy, I don't know whose legs you're looking at, but this was for the back of my legs.
Yeah.
And there was no difference. And it was not fun because you're awake for that.
Yeah. Well,
What's your thoughts on aqua?
So
Sounds so terrible.
Oh my gosh, I have plenty of thoughts on aqua lipo. So first of all, we use saline, like water, to plump up the tissues. Anyway, so aqua lipo, it's not anything. It's like that's like nothing special. That's like, I invented this thing with 4 wheels and it moves and drives you around places.
Right.
So I have an issue with the name aqua lipo acting like it's something new. But then also, anytime that you corporatize like healthcare, it's never good.
What does corporatize mean?
So the best healthcare is when a doctor and a patient agree on a plan, and the doctor does the best job, and the patient is educated and prepared and heals fine. And what some people are doing now is they're trying to make it to where the surgeon's time needs to be maximized so he can make as much money per hour, blah, blah, blah. So what they try to do is they try to say, okay, Monday through Friday, you should just be in the OR the whole time. Well, the thing is that a plastic surgeon is not just some technician who does operating. We're not mechanics sitting there below the car. And we have to see the patient beforehand. We have to be the ones making the plans. When you have salespeople that are selling you surgery and making the plan, they're not that's why we went to residency, is to learn these indications.
So that's why you should go to a plastic surgeon.
Yes, that's right. Well, even plastic surgeons' offices now are sometimes moving towards this model. That's why as a patient, number one, the plastic surgeon has got to be board certified by the American Board of Plastic Surgery, or if it's face, the American Board of Facial and Plastic Facial.
Can you be a plastic surgeon and not be certified through them?
I mean, if you're not certified by American Board of Plastic Surgery, or for face, American Board of Facial Plastic and Reconstructive Surgery. So ENT, if you do an ENT otolaryngology residency, you can do a year of facial plastic surgery and get board certified that way. Those guys are totally legit above the neck. If a plastic surgeon is not board certified, there's a reason, and so it's just a red flag.
But they're still legally allowed to practice.
Yeah. Yes. Yeah, they can practice. So,
wow. Okay.
Yeah.
So what can we do for cellulite then? Because what?
Nothing.
Nothing? Not one?
I wouldn't say
Wait,
nothing.
what about the injection?
Yeah. Well, I wouldn't say nothing. So what I would say is that if you have cellulite and you come to my practice, we can do some things. But you got to understand, number one, we're just going to make it a couple degrees better. And the generalized waviness is just something that we're just trying to barely improve. Now, what we can make better are the big dents. If you have big dents, we can take care of those.
Big dents from cellulite or big dents from aqua lipo?
Both. Both.
Okay. All right. Is it hereditary? Is it pretty genetic?
I think every female has cellulite.
Real, but I feel like some do not.
You're seeing airbrush pictures, or
Really?
you're
Okay.
yeah.
All right.
I've never met a woman who didn't have cellulite.
Okay. Someone wanted to know if she said she was told she needed to lose a certain amount of weight before she could have liposuction, which kind of seemed counterproductive to me. Is that true though?
Well, the surgeon may have just thought that she wasn't at a weight where she would, basically it sounds like maybe he just didn't want to be sucking some fat and doing that for weight loss. So he may have just been, if it's a board certified plastic surgeon with a good reputation, that he was probably looking out for her overall health and but there's no technical reason why.
Okay, you don't have to be at a certain weight to get liposuction.
I mean, not in my practice. The only thing is, if you have a whole lot of fat, you're probably not a good candidate for liposuction, just because if you're too big, then we're just going to be sucking and evacuating that fat between the skin and the muscle, and it's not going to redrape very nicely.
And if you get lipo, but then you don't continue, or you continue maybe eating the way you're eating, will it just come back?
It'll come back in other areas. Yeah,
it won't come back in the area that you did though?
Probably not. No, not if the surgeon did a good job of taking out those fat cells.
Oh, because you're taking out the actual cells.
Yeah, they're gone.
So it comes back in other so you might get.
Yeah, I did cool sculpting on my flanks.
For the flanks. And flanks are like love handles.
Yes, right? Love handles. That's right. Yeah. So I had love handles that I'm 46 now, so they've grown steadily over the past 15 years. And first of all, cool sculpting hurt. Second of all, it works.
Yes.
Because my flanks are much better now.
Okay, tell everyone what cool sculpting is.
Cool sculpting is a non-invasive body device that has these applicators. They're like big suction cups that you put on, and it freezes your fat to the point where it kills the fat cells. And that's why it's painful, because you can actually feel like part of you is dying. It's a very weird sensation. And afterwards, I thought it kind of hurt. Although men are babies, like for you, you'd probably do them like, oh, it's nothing. But men, we have no pain tolerance. So, but it worked.
Okay, I'm not going to say where it was. It was not a plastic surgeon. It was one of those kind of, I think what you're saying, corporate. This was, again, years ago. Yeah. This was during my aqua lipo phase. And it might have been the same place, inquired about the cool sculpting, same thing on my flanks, which is like your back love handles, kind of right above your butt cheeks. And she said I was not a candidate because she said it was going to look like I had shark bites on my back. And she was like, she's like, I don't think I'm going to get a good enough grip, and it's going to look like you have 2 shark bites in your back. And I was like, well, this is not the look I'm going for.
They should have done the cool sculpting on your thighs and the liposuction on your flanks.
Oh gosh. Well, they got it mixed up. They should have done the aqua lipo on my flanks. Oh gosh. Yeah, that was also, I was bruised, I think, for 2 months.
Oof, yeah.
I looked like I'd been in a car wreck. All right. Moving on.
Well, let me tell you this. So the cool sculpting, now I have more fat on my belly though.
Wait, really?
Yeah.
Okay. Worth it or no?
Well, now I just need to do cool sculpting on my abdomen.
And then it's going to
sucked out.
Then okay, so it's basically melting your fat, freezing your fat, not melting it. Okay. Yeah. But it won't come back?
No.
Wow.
Whatever's gone won't come back.
Okay. Now, and that's just inpatient.
Yeah.
Yeah. Okay. All right. You could do that on what areas of your body can you do that on? Belly,
flanks, love handles. You can do it on arms and thighs.
Okay.
Yeah.
Can you do it as jawline?
Yeah.
Does that have good results?
Pretty good, yeah.
Okay.
Yeah, I don't have cool sculpting at mine. Yeah.
Okay. Oh, you guys don't have it there?
Not yet. We might get it. I mean, I believe in the technology, but it's not zero pain. I mean, it hurt.
Okay.
And it's pretty expensive for something that, for a little bit more, I could just suck it out. So I don't know if it's worth it.
All right.
I'm not sure the juice is worth the squeeze for the patient.
Gotcha. Okay. So tummy tuck. Do you need to have liposuction as well? Like I've heard two.
I always do it. I mean, I can't remember the last time. I don't know if I've ever done a skin only tummy tuck.
Okay.
Maybe if you are in great shape and you just have a bunch of skin, yeah, you can do especially like a mini abdominoplasty
What's a mini?
So a mini abdominoplasty is a smaller scar, and at least in my hands, what I do is I separate your belly button from your abdominal wall. I just cut it and then pull that skin down. So the result is that you're going to have a smaller scar. Your belly button's going to be a little lower. It's not going to be so low that it looks weird, but it will be a couple centimeters lower. And compared to a regular tummy tuck, it's a little bit quicker of a recovery.
Okay.
Real tummy tuck is a bigger scar just from hip to hip. And in that case, I keep the belly button attached to the abdominal wall and just redrape the skin down and then pull the belly button out into the skin.
Can you stand up straight afterwards?
No, not for like 2 weeks.
Yeah. Dang.
Yeah.
Okay. So recovery time is 2 weeks or more?
A little bit more. It's 2 weeks until you can, you're kind of doing the things you want to do around the house. A good 6 weeks before you're exercising again and doing things outside the house that you want to do. If you get a seroma, that'll put back your recovery a little bit. Seroma is a buildup of fluid between the skin and the muscle, and it happens. You ever
had someone have a tummy tuck and then maybe intentionally, or accidentally get pregnant?
No, it happens.
It does.
Yeah, it's fine. I mean,
Okay.
I prefer not to. Main reason because number one is you had the surgery for a cosmetic purpose to look as good as possible, and then you're getting pregnant, re-expanding that skin, re-expanding the abdominal wall. And then the scar, might inhibit the growth of the baby a little bit. So not that it could have long-lasting consequences, but you might be delivering a little earlier and your baby's growth might, Yeah, I prefer patients to be done having kids before we do tummy tuck.
Okay. Eyelid surgery. That was overwhelming. The people who wanted to know about like the hooded, hooded lids.
Yeah.
Does it seem to be more popular?
It is. And I think partially because it's just so easy, so straightforward, quick recovery. Like you can do it on a Monday and be out to dinner Friday and no one even knows.
Are you awake or asleep?
In my hands, you're awake unless you're doing a facelift at the same time. But yeah, I do only blepharoplasty. I do that all the time.
And is it just making a incision?
Mm-hmm.
It's kind of like a tummy tuck on your eyes?
Yeah, like a tummy tuck on your eyes.
And okay, so would a candidate are you like, no, you're not a candidate for an eye lift? Or are you basically like, if you want one, you can have one?
People generally know.
Okay.
Yeah, I mean, I've done them on people in their 20s and they needed them.
They did.
Yeah.
But is it mostly just women aging and skin starting to sag?
Yeah, and men too. I have a lot of male blepharoplasty patients.
What's your most popular male plastic surgery?
Probably blepharoplasty.
What's that?
Eyelids, upper eyelids.
Okay.
Yeah.
You're using very fancy terms. We just call it an eye lift. Okay. All right. What's a brow lift?
So brow lift is where we actually lift the forehead and the brows. And so that's when your brows are low.
Okay.
And patients will generally know that they need a brow lift, but a lot of patients will come in and say, I'm not sure whether I need my eyes done or a brow lift. And I like doing brow lifts a lot. Brow lifts were all the rage. This is how long I've been at this. I started med school in 1998, and I feel like they were doing brow lifts like every day in the operating room.
Really?
And it was really popular. And then Botox came along.
Oh.
And so from like 2008 until 2015 when I finished residency, like during residency, I think that I did like 15 the whole time. I mean, they really went away in popularity. And now they're back. And I think part of it is because of Botox, because we've weakened the frontalis muscle so much that a lot of people have these tautic brows. Yeah. But I think it's also this understanding that, brows can be put into a good place doing a brow lift. You don't, back in the 90s, you see these women that had these brows.
I hope everyone's watching this on YouTube because you're doing a good job explaining it with your hands. It won't have the same effect if you're just listening. Okay. Yeah, go ahead.
Well, having your brows 2-3 centimeters above your orbital bone is really weird looking.
Right.
And so that was, especially in Dallas, like when I was first there were so many women that had that look. And I feel like that's going away, which is good. Now we're doing much more accurate brow lifting and not trying to overcorrect so much.
So it's like permanent Botox.
Yeah, pretty much.
In your forehead.
But what I tell patients is I've never done plastic surgery and that made that patient get less stuff done. If anything, they get more. So
You're like, great, my eyes are fine. Now I'm going to need this. Well, too, I think it's like if you improve, it's a slippery slope. You improve this and you're like, oh, now I might want to do this because I'm so happy with
that's right.
my eye lift. You know what I've really wanted to do is well, that takes me right into the facelift, which is perfect. All right. I was talking to a friend this morning and I was telling her you were coming on and she said, please get him to talk about facelifts. She said, because I have known a couple people lately who have had them done. And she said, you would never know.
Yeah.
You just would go, you look really good.
Yeah.
Like, have they done something with their skin? Did they lose weight? Like, did they change their hair? And I think they're, again, such that stigma of that like cat face, eyes pulled back, like that kind of terrible cartoon figure. And lately I feel like I'm seeing facelifts that are just phenomenal.
Yeah.
So I wanted to ask you the difference between a mini facelift, a facelift, and a deep plane facelift. Those are just terms I keep seeing on the internet. I don't know if they're all the same.
No, there's a difference. In mini facelift, what that meant was where people were not making a scar around the back of the ear, and they were just doing it in front of the ear.
That's a mini.
That's a mini facelift, and I feel like that's kind of gone out of favor. The results were more mini.
Gosh.
And so I think patients, and they could be a little bit weird looking because even though you weren't getting these bizarre distortions of the corners of the mouth and bunching around the eyes and we call a lateral sweep of the cheeks and Joker's lines deformities.
Yeah.
You weren't getting these things, but you're still flattening out just this part of the face and then everything else was uncorrected. So I think that we are getting better results because we've moved more towards a accurate anatomical reconstruction of youth. And in my hands, I do a deep plane facelift, although it's, I'm on these group chats with plastic surgeons around the world, and the guys arguing about who does a deep plane and who does subsmash. And I'm like, you guys are all doing almost the same thing.
So what's a deep plane facelift?
So deep plane is, so if you look, you have skin, and then you have fat, and then you have muscles that make you smile and talk. And surrounding those muscles is fascia. And it's basically like a gliding plane for the muscles to move around in. And that's called the smash. And so you lift that off the muscles and you reposition it. So
reposition the fascia?
Reposition the fascia, yeah.
Okay.
Yeah, and the muscles come along with it.
Oh,
and so that's at least in my opinion, the best way to do a facelift is to reposition that. And some people don't agree. Some people just, use sutures to reposition that tissue, and they get great results. And so it's really hard to argue with them doing it that way. But.
So are you doing above the eye and the forehead too, or is this just eyelid down on a deep plane facelift?
Deep plane, you're doing below eyelid and below.
Eyelid and below.
Yes.
Okay.
Yeah. For the brow, it depends on what the patient is interested in and all that. I'm either doing under the skin and lifting the brow from above, or I'm going between the bone and the covering of the bone and lifting it and using these plastic tying devices that we redrape the tissue over.
That sounds amazing.
Yeah,
okay. So you can just do the deep plane facelift and not touch the forehead.
Yeah, if someone's brows are in good position and I like the way their brows look, I won't do a brow lift. I don't do a brow lift on every facelift patient.
See, and I always thought a facelift was just like a full 360 oval tie back.
Well, that's how people would do them back then.
They did. Okay.
So behind the ear all the way up through the scalp.
Like take your face off.
Yes.
Okay, so that was an actual thing.
It was a thing.
No, is anyone doing that still?
No, I don't. Not as much. No.
Okay.
Definitely.
Don't
less.
go to someone if they're doing that.
No, I wouldn't say. There are guys who do that and do great work. I mean, it's just.
Well, and plus, if you have a super saggy, wrinkly forehead, you got to do something.
Yeah, I mean, I do brow lifts in conjunction with facelifts.
Okay, so you could do a brow lift and the facelift at the same time.
Yeah, I just wouldn't make my incision from all the way through here. I just, I make 2 incisions here, and then just lift the brows like that.
So the brow lift is 2 incisions at the top of the forehead.
In my hands.
For you,
I don't take out, when I do a brow lift, I don't take out I'm not removing any skin.
Okay.
So my incisions are small, and they're just to provide access to get into those tissue planes.
I feel like a lot of people are talking about neck lifts lately because the neck seems to be something when you age, you really notice.
Yeah.
And we can do Botox or Dysport or lasers on our face. And sometimes then you're like, oh, the better your face is looking, the worse your neck is not
Right.
keeping up. And then people are like, oh my gosh, like the skin, when I turn my face left to right, I see these like kind of veins come with it. Or you lean forward and you're like, oh my gosh, how do I get rid of this skin? So I feel like a lot of people like neck lifts seem to be.
It is.
Okay. Can you just do a neck lift?
Yeah.
Or you don't need a facelift?
For sure.
And where are you cutting for a neck lift?
Well, if I'm literally just doing a neck, I'm making about a 2 centimeter incision under the chin.
Oh.
And in that case, I'm just taking out a little bit of fat below the muscle that does this, called the platysma.
Yeah.
Maybe messing with your glands here and making them a little smaller, and then putting everything together and making it tighter.
So
now,
it would also get rid of a double chin if you had a double chin, if you had a lot of fat under your. Okay.
That's the whole reason for doing it.
Okay, so it's skin and fat. If you have,
I'm not taking out any skin in that situation. If I'm taking out skin, then I'll make the incision behind the ear.
Oh, behind the, okay.
And that's how I'll take out skin from the neck. But I'll take out much skin from the neck, even when someone needs, if you just do this,
pull your neck back.
Yeah, pretty much corrects most neck stuff.
Yeah.
So I don't really see you need to take out a whole lot of neck skin. I mean, a little bit, you've got to, but I don't take out a whole lot.
But you could do both. If someone had fat and excess skin, you would do both at the same time.
Yeah, I take out, I wouldn't say a lot, but I'm aggressive about taking out fat from deep in the neck, because that's the cause of a lot of what you see when you see someone has double chin. Most of the time, it's not superficial, like under their skin. Most of the time, it's deep.
It's deep fat.
Yeah, and I can lift this, called the hyoid bone, that makes this angle, and I can lift that with sutures and releasing fascia around the bone.
And does a lot of that just come from aging, gaining weight in your neck?
And some people have a naturally low hyoid bone.
What's a hyoid bone?
This bone right here that makes this nice angle.
Okay.
So some people's are low naturally, and so they just don't have good definition, so they need it raised.
Okay. Is there an optimal age to get a mini facelift, deep plane?
No. I mean, it's just whenever you want to do it. I do patients that are like 38, and I do patients that are 68.
You've done a facelift on someone who's 38.
Yeah, she needed it, and it was really more of a neck, removing volume from her neck, because her neck, she had some weight in her neck that needed to be removed.
Do you feel like you ever get patients who come to you, I don't even know what it's called, but they're seeing things that you are just not seeing?
I think I'm very blessed I have really good patients. I hear the stories from other guys. I just don't get that. Okay. I mean, sometimes patients will think that they need something done, and I definitely talk patients out of surgery, and I probably say no to, a third of patients that come in, but generally patients come in and they know what they need and they know what they want. I don't know if it's because like Instagram and people are reading more about it and there's just more information available, or what the deal is, but I really don't get. I remember in residency, just there were a lot of patients that were a little bit. My attendings had a lot of crazy patients. I don't know if it's like the Texas heat.
Texas heat. It's all the facelifts and the boob jobs at 18 and the heat. It got to them. Well, and I do think that's why, because you're saying I say no to a third of, there's probably a lot of doctors who are like, I'm not saying no, that's money.
Yeah, we got to pay rent.
Right. And so that's what I've always said. Like, I'll say to people, I'm like, you have got to go to someone and know your personality. My personality is such, I am like happy to wade into those waters.
Yeah. And
so if I was at a doctor and he was like, you know what you really need? Oh, it looks so good. I'd be like, okay, sign me up. And I think that's what's good. What I really like about seeing you is I've said to you, do you think I should do this? And you're like, no, not yet. I'm like, wait, what? Like, why not? You're like, no, you don't need it. And kind of like, wait, but I kind of wanted it. Like I saw someone else do it. And you're like, no, you don't need it. But it's good for me because you kind of keep my toes back from getting that too far, which is a good thing. I'm very happy with that.
Well, I think that it's tough for doctors to say no to patients sometimes because they don't want to lose the patient.
Right.
And they, we do have bills to pay. And so it's like, oh, okay, well, I'll do it. But, if someone needs a tummy tuck, but they're like, I don't want to do a tummy tuck, I just want to do liposuction, don't do it. I mean, that's the kind of thing that I turn away. Is like when I just tell patients, some patients listen, some don't. And when patients have sometimes patients, okay, I'll give you an example. A patient who was a male patient, and he's super good looking, very good physique. But when he was talking to me about doing liposuction, I was like, you just need, he's like 30 something. And I was like, you just need some liposuction around your abdomen. But in talking to him, I realized that he really wanted aggressive body sculpting. And I just don't do like aggressive body sculpting.
Yeah.
But, I have a buddy, Roberto Ramirez. He does it, and he does a great job. So I said, why don't you go see Roberto? And, that was the right fit for him, and he had a great result. And so, sometimes just patients, what they want to do is not in your wheelhouse.
Right.
And that wasn't really in my wheelhouse, and aggressive body shaping in a young man is, but that doesn't mean that it's not legitimate. And it
for
wasn't
him.
right to do. For him, it was right, and he went to the right guy. So,
well, but I think people appreciate that about you as well. Yeah. Okay, this is a random question. I just thought of this when you were talking about going to another doctor, or because I would imagine there are other doctors too who are like, I am not doing that size implant on you. That's
right.
way too big.
Yes.
And then the patient's like, all right, well, I'll find someone that will, or this is my cost. And the patient says, I am not paying that. I can get it for cheaper in Mexico or in another country. And what are your thoughts on someone saying, I'm going to go to another country and get a better deal solely for money?
So if you're going to another country to get a better deal, it's generally not a good idea, because I have colleagues in Colombia that are the best body contouring surgeons. They're amazing. I have buddies in Turkey, and they're the best rhinoplasty surgeons in the world. Guys in Brazil that are the best facelift surgeons in the world. So it's not that United States has a lock on the best plastic surgeons ever. We don't. I mean, honestly, and when I meet guys from other countries, I see the results, I see the things they're doing technically. I'm like, oh my gosh, I need to get better. And that's why I'm always studying, because like these guys really, you see the results and you want to get better. But when you're going to like the discount clinic in another country, and it's like, oh, well, come to Costa Rica and enjoy a vacation while you recover from surgery. That's just, generally that's not a good idea. But, and I saw in Houston a lot. In Houston,
people going to another country.
They would go to Mexico, and they, it was like clinics just over the Rio Grande, and they would have disastrous outcomes. I mean,
well, there's just so much that can go wrong.
Yeah.
Oh my gosh.
And it's, it's just generally a good idea to have surgery close to home if you can. Okay. And I have lots of out-of-town patients, and I tell them, I'm like, well, have you talked to so-and-so in their town who I know them, and I know they do a great job. And so, and it's not that I'm trying to talk them out of it. It's just, it's nice to recover at home.
Yeah. Okay. Perfect. All right. So say no to going to Mexico.
Yes.
Any other surgeries that help with kind of like just the overall look of aging that don't kind of fall in those 5 main?
So the thing that I love, that I think I do a really good job, very subtle, is upper lip lift.
Yeah.
And it is, a lot of times, you're talking about the bizarre facelift result. A lot of times those patients, it's not that they had a bad facelift. Their facelift actually looks good, but their lower eyelids look baggy. Their upper lip is covering their upper teeth. Their neck wasn't addressed. So, addressing things that previously we didn't think to address is really important. And so I was blessed to be in DC, where it was like the Austin Weston group was these very popular plastic surgeons in the DC area. And I got to spend time with them as like a college student, and they were doing lip lifts back then. And everyone was like, oh, how can you put the scar underneath the nose and all that kind of stuff? But I mean, I'm doing them all the time.
Can you tell everybody what a lip lift is?
So lip lift is where you remove skin below the nose from the upper lip. And it does a few things. One is it rotates the lip out, so you have a fuller upper lip, and it shortens the upper lip, so you show a little bit more teeth, and it makes the upper lip look more tense, which at first really freaks people out, and it hurts. And I tell every lip lift patient, I'm like, for a month, you're going to hate me and regret doing this. And then after a month, you're going to absolutely love it. And it's just, lips are very sensitive, and And when you're going around looking like a rabbit for a month, you're like, oh my gosh, what did Dr. Hatef do to me? But then it relaxes, and then you have this nice, youthful, pose to the lip. So I'm a really big fan of upper lip lifts.
Okay. If someone does not want a surgical procedure, doesn't want to have the cost, doesn't want to go under the knife, the anesthetic, etc., what are your favorite non-surgical ways to kind of the biggest question was, I want to look more awake. I look so tired.
Yeah. Well, just good skincare. Retin-A, starting with retinol, moving up, graduating to true Retin-A.
Okay.
Botox. These great things. PRP, filler.
Botox over Dysport. I love
Dysport. Yeah. I love Dysport.
Okay.
No, Botox is like my general catch-all term for botulinum toxin. There's something new called Daxify, and they're saying it lasts 6 months. We'll see. I haven't jumped in yet because the last time we heard something last 6 months, it lasted like 6 days.
Oh God!
So I'm letting everyone else discover that.
Be the guinea pigs first. All right. Okay, filler. Again, kind of like facelift. I feel gets a really bad rap.
Yeah.
And there's that expression, that filler face, which is like the overdone chipmunks, big cheeks, big kind of all puffy looking face. What is that? Is that just too much filler? Is that what that is from? Just too much?
Too much filler.
Okay.
Yeah. And I love hyaluronic acid gel filler because it's natural gel filler. If you do it in very small amounts, a little bit at a time, it can be great.
Okay.
It can be something like very little that, people don't know about and makes you feel better. Okay. And I can balance faces with it. But people got to know it is, number one, it is kind of like an implant. I mean, even though it's naturally made, like hyaluronic acid naturally exists in the body, this is hyaluronic acid from a rooster comb. So,
For real?
Yeah.
Okay.
Yeah. It's from rooster combs. And so, it is a foreign body.
Yeah.
And it can cause problems. And so it's not something that people should just, oh yeah, let me just go get some filler. Right. And I understand people do that. And you can make a nice change in one sitting, and that's very tempting, but
I love filler in my temples. Speaking of something that I feel like is one of those like kind of sneaky things you do that no one really knows that you did anything, but it just makes you look. I noticed it immensely on myself, like day 3 or 4. I was like, wow, I didn't notice a difference.
Well, you're in very good shape. Patients who are in very good shape, they have little subcutaneous fat. And as we age, our subcutaneous fat deflates. So in the temples, it's really a place that happens. And because, it's covered with hair and no one ever thinks about temples because they're on the side of the head, it just doesn't get enough attention. But I think it's a game changer.
Is the rule of thumb, isn't it something like if you can no longer see the tips of your eyebrows or something, you need it? Is that wrong?
How
do you know?
Some people have these kind of rules, but you can just kind of see it's like in a young person, they have a highlight here. Like if you Google the actress in the Elvis Presley movie, these young actresses that are so beautiful, they have highlight. It's like light bounces off here. I'm 46. Light doesn't bounce off here. This is a shadow in me.
Off your temples.
Yeah, I know I need filler, but
okay.
I'm too busy.
You need to get some temple filler. Aging hands.
Yes.
Filler?
Yeah, filler's great.
I've never done that.
Yes. I love Radiesse. I love Sculptra. Great for
so
hands.
Difference between Sculptra and filler.
So basically there are 2 categories of filler. One is the hyaluronic acid gel, and then the other is biostimulatory. So, they're filler. The gel generally goes away. 80 to 90% of that volume is gone in a year. Biostimulatory fillers are fillers that are stimulating your body to produce its own collagen and elastin. And so in some ways it's more natural. I mean, I don't think that's the case. I think they're all somewhat natural, but not really.
But the Sculptra lasts longer?
Not necessarily. I mean, you do more. You do a series of it, so you're planning to do a series of it over time, and I think it's great. I love Sculptra. I love Radiesse. They're great fillers, and over time, more stuff's going to come out. I mean, there was something called autologen, which was your doctor would do a punch biopsy, and they'd send the biopsy off to some lab, and you'd come back with like your own collagen. And it was just an idea ahead of its time. At some point that is going to be, something like that is going to come back again. And, 10, 15 years from now, we probably won't even use all these fillers. We'll have oh, you weren't using autologen,
What's wrong with you? I volunteered to be your first patient for that.
Love it.
I will take that. Bags under the eyes. Surgery, filler. What's the...
Your Canadian accent was coming out.
What did I say?
Bags.
Oh, bags. Bags under your eyes.
Bags, yeah. So there are a number of ways to address them. The best way is to reduce the size of the fat pockets.
Okay.
So make an incision either inside the eyelid or on the outside. And it just depends. If you don't have any excess skin to take, so if you had eyelid bags, then I would make an incision inside the eyelid.
Okay.
But most patients who come to me, they have excess skin. And so I'll do a lower blepharoplasty where I'll remove a pinch of skin.
Okay.
And through that incision, I'll poke holes and tease out a little bit of fat.
What are people aiming to do when I hear people say they're getting filler under their eyes? What is that for?
So that's to support, that's for people, in my hands, the best patient for that is a patient who has kind of, the bone here is not very strong. So when your bone is not very strong, from an earlier age, you're going to see those eyelid bags and those fat pockets are going to protrude earlier. And so, if you have a 27-year-old girl who has that, it's good to put some volume there. And if I do a blepharoplasty in that patient, which sometimes I will, I'll always talk to them about injecting fat because the fat serves as a volume to support the lower eyelid.
Their own fat?
Their own fat, yeah.
Oh.
Yeah, if we're going to the operating room, I'll talk to them about doing that anyway.
Yeah, because then you don't have to keep getting it done.
That's right.
It would just stay.
Yeah, and I just do a little bit. The eyelid fat, especially if you are below the age of 40 as a woman and you have facial fat grafting, the surgeon needs to be really careful about not injecting too much because when you hit menopause and your metabolism changes, that fat can grow. So I actually have a lot of patients who I've done facial liposuction on and used radiofrequency Accutite to tighten up that area because they have these weird growths of fat and they went to the guys who are the best in the country at that time, guys who pioneered fat grafting. And they're like, I had the best result for 20 years and then it started to grow. And so I've been hearing that story more and more and more. And so, you just have to be careful in a young female when you're doing facial fat grafting. I'm not saying you can't do it. There's some guys like, oh, you absolutely cannot do it.
But you have to be careful.
You have to be careful.
So you don't have to get face lipo when you're older.
Yeah.
Face lipo. Oh, gosh. This is getting worse. Okay.
I'm going to start a new chain, Face Aqua Lipo.
Face Aqua. And then I just should fix it with the cool sculpt. Oh, my gosh. Okay. Skin tightening that's non-surgical. Any way to do that?
Yes. So Morpheus radiofrequency
Morpheus 8,
is really good. I mean, it's like finally we have a non-invasive device that actually works. It's really...
What is so I've heard like Morpheus has the radiofrequency. Now you can do microneedling with radiofrequency. What is radiofrequency doing to your skin?
So radiofrequency, it's a wave, and it is a wave that causes your collagen to tighten up.
Okay.
It's basically heating it and forcing that collagen to tighten up, and it's doing that in bulk. So you're getting redistribution of your skin.
So it's kind of like a extra, like whatever your procedure you're doing. If you add the radio frequency,
I add it a lot.
Yeah,
I do it a lot.
Yeah, because I had microneedling and it was good. Then I had the RF microneedling and it was amazing. Yeah. Amazing.
Yeah.
Can you tell us? Obviously, we're not asking you to name any names.
Sure.
Has anyone just ever come in asking for something just crazy, like where you're just like, this? I've thought I heard it all, and now you don't have to answer, or we can edit it out.
Like I said, I mean, I really don't get too many absolutely crazy requests from patients. I mean, when I was in residency, I saw a lot of crazy stuff because I was in Houston, Texas Medical Center, biggest medical center in the world, and we drew patients from literally all over Texas except for like Dallas, and so we get a lot of crazy stuff. And I mean, when I was at the county hospital, I mean, we had prisoner that chopped his own genitals off, and we replanted it. Yeah, we took him to the operating room, and with the urologist, we replanted it.
Wow.
Yeah. And then I think I was a 4th year resident when we did that. And then when I was a chief resident, guy came back, he did it again.
The same guy?
Yeah.
I mean, at this point, it might just need to stay off. Did you put it back on?
We did, and it worked. I mean, I don't know if it worked, but I mean,
what did he say? Why?
Successful.
I'm just really curious at this point.
Yeah, I think that he had ended up in a bad spot. Clearly,
yeah, like mental,
yeah,
probably, yeah, issue. Wow,
yeah.
gosh,
Dealing with demons,
Yeah, like self-harm.
Yeah, and that's obviously common, and it's how a lot of people end up in prison.
Okay, yeah, well, that's true. Do you ever, well, I don't know if people ever say this to you, or do you ever think that social media and filters play into people's ideal of what they should look like?
Definitely.
Or does anyone ever say, like, I want to look like the filter, I want to look like this?
Well, people, yeah, I think it makes people have unrealistic expectations for themselves.
Okay.
So that definitely feeds my business, but it's also not good for people's mental health to think that everyone looks, amazing.
Yeah.
And so, back in the day, in like the 1990s and early 2000s, it was like, the only people who had people take multiple pictures were models. And so, they go, you'd have thousands of pictures taken, you only choose your best one.
Mm-hmm.
I remember I used to think, man, if only everybody could take thousands of pictures and choose their best one, then everyone would feel better about themselves and they'd know that, okay, well, it's just because, but that's not what, now that's actually happening, that's not what happens. It's like people see other people on Instagram and they see them at their best and like having the best time. And so everyone thinks that everyone else is having a much better time and looks much better. And, it's not the case. Everybody still deals with issues and
everybody's struggling.
Everybody's struggling.
All right. This question actually also was asked a lot. And I really didn't know much about it. So I Googled it, which then I went down a very dark road. And I was like, I didn't know this was such an issue. The question about the technical term is labiaplasty.
Yes.
Same as reconstruction? Vaginal reconstruction?
It's cosmetic. I mean,
which one's cosmetic?
Labiaplasty.
Okay.
But for the girls who need it, it's absolutely necessary.
Yeah.
And so, I'm not demeaning it by saying it's not reconstruction, but because
it'd be painful.
Yeah, for sure. Oh my gosh, they have, pain with intercourse, hygiene issues with urinating. It's and it, the thing is, it's really easy.
Is it easy?
Yeah, it's easy. You got to avoid sex for 4 to 6 weeks.
Inpatient, outpatient?
Outpatient. Yeah.
Asleep.
Yeah. Well, you can do it awake in the office, but in my hands, it's pretty much done with other surgeries like breast augmentation, tummy tuck, mommy makeover.
Oh, so they're kind of like while I'm here.
Yeah. Yeah. And everyone I've done it on, they need it. Like if it's not one of those things where it's like, if you need it.
If you need it.
Yeah.
Okay. If someone is looking for it, you said they should be board certified.
Yes.
But if they're not living in Nashville or living somewhere else, what should they be looking for when they're coming to, where if they're like, okay, I want to get my boobs done, or I think I want to get lipo, what's our next steps?
The best thing to do is to start with 3 sources: American Board of Plastic Surgery. Mm-hmm. So make sure the surgeon's certified by the American Board of Plastic Surgery. Or if it's above the neck, American Board of Facial Plastic Surgery. That shows that they're legitimate. The second resource is ASPS, American Society of Plastic Surgeons. Mm-hmm. The third resource is the Aesthetic Society. So it used to be called American Society of Aesthetic Plastic Surgery. Those 3, your surgeon should be board certified. They should be a member of their societies, and you can use those tools to look surgeons up. They should be listed on those sites.
Okay.
And then from there, just check out their website and their social media and see, because you can get a really good feel for what someone's like on social media. See if you like their personality and like who they are, and look at their website. See, we don't post many before and afters, and so Some surgeons do, some surgeons don't. But, try to see what the before and afters are like. And then talk to your friends. I mean,
Yeah, who they've gone to. Find
Yeah.
someone you like.
Yeah.
You like how they look.
Yeah, that's right. It's, you just got to do your research and
Yeah.
not be compulsive about it. And don't let anybody tell you, well, this is the way to. I see that with a lot with the breast implant honest patients. They have an idea sometimes in their head about what they need done, because I feel like they're almost like bullied sometimes by the so-called expert patients who are like, well, you need this done and you need this person. It's like, just you got to make a decision for yourself, and you got to do your own research and find who you like.
Do you have an ideal age someone should start Botox or that? Because people are like, what age should you start Botox? I mean, does it really personal preference?
Yeah, it's totally personal preference. I mean, honestly, Jennifer, I'd say once a month. My office is right next to 360 Bistro. So after work, sometimes I'll go there. And I think at least once a month I meet a woman there who has never had anything done. And she's like 60 years old and she looks great because she just, avoided the sun and took good care of her skin. And, I think if you just avoid the sun, take good care of your skin, I think you can look great. So it's just personal preference. I have patients that get Botox and they're like 23 and they look great too. They don't look weird or overdone. So,
okay.
Yeah.
If you have a procedure done, when are you like let's say you're, I don't know, 2-3 weeks out and you're like, I'm not really happy with this, but they said it could take a long, when are you done healing? Like, when are you like, this is as good as I'm getting?
Well, it depends on the surgery. I'd say breast stuff, probably, 6 months.
Okay.
Face stuff, especially nose, 12 to 18 months.
Okay.
Yeah. And, just if you're not happy with your result, just be honest with your plastic surgeon, because sometimes we'll be so happy because we see so much. And so it's like sometimes, we'll see a patient who is like in that healing phase and they look awesome. And I'm like, oh my gosh, you look great. And so I try not to say that because I don't want to I want to hear how they're really feeling, but, just be honest with your surgeon, let them know what you're feeling and what your thoughts are.
Well, and I think that's one good thing about you too. I like is that you always are like, well, I think the first time I ever came to see you and you were like, tell me what you see. Like, what is it that you see when I was looking in the mirror? You're like, tell me what you see versus you just coming in and saying, you need to do this, you need to do this. I mean, I would think I was pretty bang on in terms of what we were both seeing. But just kind of, you don't come in and try to just take over and say, this is what you need to do. And then the patient's like, I don't really know if I was ready for all of that.
Yeah. I mean, honestly, I think nowadays most patients I see know what they want.
Yeah. And I think social media probably helps.
For sure.
What do you say to, I would say men, but let's be honest, probably mostly women who say you should just let yourself age naturally. None of this we shouldn't be talking about. We're setting a bad example for our daughters, et cetera, et cetera, et cetera.
Well, like I said, there are people who I meet that have never had anything done. They look great. But if someone wants to make a change and it's something that's doable and safe and they're experts in it, why shouldn't you spend the money and the time doing it if that's something that's important to you?
Yeah.
As long as you're educated on the risks and the benefits, why do you need to fly to Tokyo for vacation? Why do you need to
get your hair done?
Yeah, get your hair done.
Go to the gym.
It's just like, people need to do what they feel is best for them at that point and make sure that they get educated on it. Don't jump all in without knowing.
Yeah.
And I do have female patients that come in with a husband and the husband will be like, oh, I just don't think you need that. And I think that they think they're complimenting their wives. Because
agree.
Yeah, they're like, you don't need that. And what I tell them is like, listen, you have to understand, like, let's say you love cars and you want to get a Ferrari. If your wife says, oh, you don't need that, do you take that as a compliment and they're like, oh yeah, you're right. So it's just, men have to understand the point of view that the woman is coming from. It's not that you letting them do that isn't you saying, oh yeah, you need to do that.
Yeah. And I don't think most women who are doing these procedures, big or small, are doing it for their husbands.
No.
They're probably doing it for themselves.
Yeah, for themselves,
hopefully.
for sure. Yeah.
And their friends.
Yeah. Yeah. Well,
Really?
I mean, I mean, self-confidence is just such an important part of life. And it's like, you're going to be a better wife and mother if you're feeling happy about yourself and not constantly focusing on, oh my gosh, I have, this extra skin on my abdomen, or everyone's looking at my neck, or.
Well, and everybody, I think, talks about this term of aging gracefully.
Yeah.
And I just think it doesn't matter who you are. Even if you're two people who don't believe in plastic surgery, your idea will still be different.
That's
Maybe
right.
one person colors her hair and the other decides she's going to go gray.
Yeah.
So your idea of aging gracefully.
Yeah, I think aging gracefully now is like just getting little things that no one ever really knows what you did.
Right. And how about being kind to one another?
Yes.
When we talk about it,
I know.
being kind. Yeah.
Yes.
I agree. Well, I appreciate you, and I am so
Thank you.
thankful to have you here today and sharing all of your expertise and just keeping us all looking good. And maybe we'll have you back another time.
Oh, I love it. Thank you, Jennifer.
All right. Thank you.
Yeah, always good chatting.
Thanks, you too.